Hello everyone, and welcome to the latest in our Practice Perfection web-based educational series. I'm Danny Bobrow, President of AIM Dental Marketing, and it is my distinct pleasure to have with us this evening Dr. Dawn Ewing, whose presentation is entitled Biological Diagnosis and Therapy, Exploring Holistic Health Alternatives. Dr. Dawn is Executive Director for the International Academy of Biological Dentistry and Medicine. She is owner of Holistic Health Alternatives, a Houston-based integrative practice which helps its patients find and benefit from the dental medical connection. She holds a PhD in integrative medicine from Capital University, is a registered dental hygienist, licensed paramedic, and holds a number of other licensures. You can learn more about her at her website, drdawn.net. So we're not going to spend any more time with introducing her now. We will, at the conclusion of today's presentation, offer a couple of very special opportunities to expand your understanding of how to incorporate biological dentistry into your life and practice, so you'll want to remain on the call for that. You'll also want to stay connected because following Dr. Dawn's presentation, you will have the opportunity to ask questions of Dr. Dawn. So you don't forget your question, you'll be able to ask it during her presentation without interrupting the presentation, simply by typing your comment or question into the lower right portion of your screen where it reads questions. So with that, it is my sincere pleasure to introduce my friend, Dr. Dawn Ewing. Dawn?
Danny, thank you so much for the opportunity to be able to just share the words and get the news out there that there is a different kind of dentistry. I'd like to thank you on behalf of the Academy as well for an opportunity to talk about the Academy.
Well, it's our pleasure, and I think it's very important, and that's why we agreed to do this. So you're welcome.
Thank you. Do we know what kind of practitioner is on the line?
Well, I think we're going to find out, and with the help of our moderator, Virginia, let's go ahead and poll the audience. We have a really good attendance today, and let's find that out. Virginia, go ahead, and thank you for posting that. So the questions are, what kind of practitioner are you? And some of the options are massage therapist, all of the options, chiropractor, dentist, physician, or nutritionist. We actually should have probably had an other, but we sort of were remiss in that. If anyone is other than that, please chat with us. Send a question as a comment and let us know. But let's open up the poll now and give the attendees a few moments to let us know, and that'll certainly help us know who we're speaking to. Okay, responses are coming in. And let's just close it out in about 15 seconds, give everybody a chance to let us know. All right, 5 seconds. All right, so the results are that a full 87% of attendees are dentists. That's not earth-shattering news. And 7% are physicians. And that leaves a 6% that must be something other than those two choices, a nutritionist, a chiropractor, or a massage therapist. So, okay, very good. So we're speaking largely to the medical and dental community, and that's as it should be. Let's continue to get an idea about where we're at and where our attendees are in terms of their experience with biological dentistry. Virginia, can you post the next poll, please? Very good. So in terms of your familiarity with biological dentistry, please select 1. I am unfamiliar with it. I consider myself to be a biological dentist. I believe it to be leading-edge medicine, or I am skeptical as to its credibility and efficacy. Please let us know what your feelings in relationship are to biological dentistry. And we'll just leave a few more seconds for people because it looks like we've almost got 100% of responses now. Okay. Well, it looks as though the folks who are unfamiliar with it are in the majority. A full 59% answered in that regard. As you can see, a number of people, 24%, consider themselves to be biological dentists. That should be a great opportunity for an exchange of viewpoints. No one seems to be skeptical as to its credibility. I think that's a very good indication of first of all, how far we've come, and the awareness and education of the attendees. And that's wonderful, because that means that we don't need to spend a lot of time debunking myths and other misconceptions concerning the field. So that's great. Thanks very much, Virginia. And now let's continue with Dr. Dawn's presentation.
Can you see my screen?
Yes, we can.
Okay, great. Just wanted to make sure. We're going to start this by talking about a couple of different tools that I use in my practice. I use EAV, which is electroacupuncture according to Vol. I use it to check the teeth. I also use it to check different acupuncture points on the body. My practice uses thermography. That is not only used for breast screening, but we also use it in the dental applications, and you'll see that later in the presentation. I look at an awful lot of blood work to look for deficiencies and infection markers. I also use a CIMT in my office, which, if you're not familiar with that, does carotid artery imaging, a great tool to get people to floss. When they see inflammation in those carotid arteries, and I tell them that one way they could reduce it would simply be flossing, it really is eye-opening for them.
Yeah, I should say that was an eye-opener for me, Dawn. I had the test performed earlier this year, and most of my markers suggest that I'm quite fit, but the CIMT was not all that great. It showed that the age of my arteries was several years older than my chronological age, so that was good to know, and I'm working on dealing with that.
And here's where networking with a different kind of practitioner becomes just incredibly valuable, because you might not have this in your dental office, but you would know who to be able to send this person to, because that individual is going to come in for cleanings more often than someone who has a smaller intima reading.
Mm-hmm. And we're going to talk more about the opportunities for networking and growing your professional referral network later on. There's often the choice of whether to outsource or to incorporate this as an offering in your practice. I mean, dentists can perform CIMT testing, and they can even do thermography, if I'm not mistaken, right?
Yes, they can. Yes.
Okay.
So most of the therapies that we end up doing or suggesting in our office, the number one thing is dentistry, believe it or not, and that's not something that I do. So I have to network with different dentists and find places for them to go. But if you're looking at how people heal, 80% of people's problems seem to stem from something in their head, and that something in their head is usually their dentistry. And then a lot of what we do is chelation and nutritional work, and we also look for genetic flaws, because if I can't get nutrition in because of some small flaw like the methotetrahydrofolate reductase gene, if it shows up positive, those people just simply need to be on a methylcobalamin instead of the cyanocobalamin. It's something so easy to do, but unless I look for it, I don't necessarily know to move them in that direction.
Mm-hmm.
So what kind of dental problems could be causing health problems? Well, first off,
may I interrupt you for a moment, Dawn? I'm sorry. Are you advancing your slides? Because I'm still seeing your first slide.
Oh, no, it is advancing.
Okay. Virginia, are you able to see these slides?
I'm just seeing the first one, like you.
Oh, okay.
Okay.
Guys.
What about the others? Could anybody let us know? Post a question if
Can
you just the first
Can you see
slide.
it now?
We can see it now.
We can see it now.
All right.
Okay.
I thought that the action was a little slow there.
You're right.
We're good now.
Okay. So here we're looking at what kind of problems. Can you also see let me minimize this.
No, it looks good.
All right. So here we're looking at the fact that dentistry is toxic not only to the patient but to the staff. So actually some of my patients are dentists. Some of them are staff members that work in dental offices. And that's because of the different exposures that they have just simply trying to get good dentistry done.
It's toxic to the environment too, potentially, right?
Oh, yes, absolutely. So we'd like to know what is biological dentistry, and I think John Trowbridge, who is our past president, when he came on board said, gosh, it just makes so much sense to me when you look at the word biological and you realize that the root word bios means life, the rest is just logical, which I thought was pretty good.
Mm-hmm.
But truly when we're looking at biological dentistry, it's a specialty within the dental profession itself. It does all the regular kinds of dentistry that most dentists provide, but it's concerned with things like dental materials and the techniques and the procedures and how they might affect the entire body. These dentists are usually really trying to focus in on reducing burdens to improve overall health. And that includes a lot of different things that we're going to talk about this evening. One might ask how a biological dentist would be different from a regular dentist. Well, they all went to dental school, but these people have made personal choices not to use amalgams. These would be the dentists that I would be referring my patients to. They not only don't use amalgams to restore teeth that need restorations now, but they also practice safe mercury removal protocols. There's a huge, we use different words. There's a difference between being mercury-free and mercury-safe. For me, a mercury-free office means that they've made a personal choice not to place new mercury fillings. A mercury-safe office means that they're providing the protocols for the safest removal of that mercury. And we're going to talk about that just a little bit. A biological dentist provides testing for each individual patient that comes in to make sure that they're not going to be reactive to the different dental materials that they may be using for them.
I think that's an important distinction, too, of a biological dentist, Dawn, which is that they really do, you talk about the patient-centered practice, and here I think is a quintessential example of where we really do look at the patient as an individual. We do these individual tests to see what materials they might be sensitive to, and I know you're going to talk about those tests shortly.
Right.
But I think that's an important, not just distinction, but a benefit, and that's something that a patient can very quickly and I think easily appreciate, and that goes a long way toward differentiating your practice.
I would imagine that everybody that's on this particular call is very aware of the makeup of an amalgam. I do still run across dentists that don't understand that mercury is a known neurotoxin. And the patients come in and they're really educated more so than they used to be in the past. And so I just want to throw out a few things that the patients seem to be very aware of, is that one of the amalgam fillings, which weighs about 1 gram, contains 1/2 gram of mercury. And so if we look at that in a perspective of the average adult having about 10 fillings, that means there's about 5 grams of mercury that are available. And the way we can best show that is to say that 1/2 gram of mercury in a 10-acre lake would warrant a fish advisory. Now here in Houston, we're petitioning our mayor to try to get it mandatory that dental offices have mercury separators. Because again, biological dentistry would like to think that we're trying to be safe for the environment as well. And we have some mercury in our main Lake Houston, and it's already showing up in the fish.
Right.
So when we ask what materials would be better than using mercury, I wish I could just give you a pat answer of, okay, everybody's going to use Empress crowns. There isn't one item that I have found that is okay for everybody. If I gave you the example of a strawberry and told you that I was going to give you the most organic, clean, crisp strawberry you'd ever eaten in your life, but you were allergic to strawberries, it probably wouldn't be a healthy choice for you. So we look at these materials and we try to find non-toxic materials. BPA is a big item now. So, patients come in, they also want to know if it's BPA-free. We want to make sure that that person is not reactive to that material. So I put on here that there are many choices, but the best choice is the one that's determined by compatibility testing. There are two different labs that use blood work. One of them is Biocomp, and the other one is Clifford Laboratory. They use blood testing to look for sensitivities. But here's an opportunity for you to network with a chiropractor, an MD, a DO, or someone who does muscle testing. It might not be you that wants to get involved with learning to use EAV equipment or learning to do applied kinesiology, but here is where you would send your actual dental materials to them, and they would test the person. And so you would send them to that practitioner, and they would get testing done, and then they would refer them back to you. So it just becomes a good marketing tool.
And that's the key to growing your network, as our attendees know. It's you've got to add value to their patient experience and vice versa, and that's the true essence of collaboration. That's great.
When we look at Proposition 65, which was in California, it was the first time that we really had to start educating patients about their right to know what was going in their mouth, and that the doctors had a right to know what was going in somebody's mouth. And it really started off where it was focusing on mercury and nickel, and now it's just branched off. If you're in California, you know, if you can't go to a hotel without seeing Proposition 65 signs all over the place warning you that there may be something in this building or your hotel room or wherever. They're just all over the place. But it is.
Are you aware?
Don't here in Texas.
Are you aware of similar movements in other parts of the country, Dawn, other states?
I am not. I would love to know if there are others. The only one that I've ever heard of is California.
Yeah, maybe some of the attendees could share with us if they've heard anything. We can share that with the audience.
So this is a question that I get from every patient when they find out they've got to have dental work. So can any dentist remove the mercury fillings and replace them with an alternative material? Can I just go back to my regular dentist? The answer is yes and no. Yes, by law they're licensed and they can do it, but it is important to me if that person really has a high level of mercury already that I send them to someone who is a mercury-safe office. And so when we're looking at that difference in terminology between mercury-free and mercury-safe, here it comes again. I have given you a link so that you can learn a little bit more about this. But actually, when someone is doing a mercury-safe protocol, we're looking at using things like breathing air. I don't want them breathing the mercury vapor that's coming off of what's being generated from that drill touching the tooth. I'd like for them to have a rubber dam on. That's not going to prevent the vapor. It's going to have a high-speed suction on the opposite side of that. I'd like for them to have some form of safety glasses on. They need to have an alternative source of air or oxygen by the nasal mask. We want to make sure that we protect their eyes, and we want to isolate the area with the rubber dam and use the saliva ejector. One thing that's really key is using copious amounts of cool water as a spray focused directly on the junction of the handpiece burr and the filling while it's being removed. And then we want to use a technique where we're calling it chunking, and that is where you're removing the mercury filling into as large a chunk as possible and keep up with that abundant rinsing. We'd like
and
to
sort of minimize the surface area.
Yes. We'd like to purify the air that's in the room with an ionizing filter and a mercury vapor filter system that will help collect mercury that's being generated in the air from that mercury filling. And then I think the most important thing is we need to make sure that we're protecting the staff. The doctor and the staff are getting far higher exposures than that patient is with that appointment that they're sitting there, because you're doing it all day. So I inform a patient that if your doctor is following the protocols, you will know that he's protecting himself when he comes in with a gas mask that looks like it has a mustard gas mask on with the cans on the side. And don't be alarmed. It just means that he's probably taking that care of himself and that he's going to be jumping through hoops to take care of you. Those protocols are not anything that I spelled out. The IAOMT and the IABDM both have those protocols pretty well spelled out, letter for letter, as I detailed there. So we go on to our networking, which our patient is going to require. For those of you that have placed a bridge or a partial or a denture and you've had to do adjustment upon adjustment upon adjustment, that person will probably be better served by going to see a chiropractor first, having their atlas and axis put into complete alignment, and then not biting down all the way, put some cotton rolls in so that the first bite they make is on your articulating paper. That way, you get a nice bite. Otherwise, you're playing a game between you and the chiropractor where you adjust their bite and then their back goes out. They go to their chiropractor, they get adjusted, and then their bite goes out. So it's a back and forth.
Oh, that's interesting.
Chiropractor can really be a good tool networking.
Mm-hmm.
Then you'll need your MDs and your DOs to help you find some things, chelation, to do the heavy metal testing, whether it's a urinary challenge, drawing blood levels to see if they've got clotting disorders. Your naturopath, depending on what state you're in, will be able to help you do that. Your nutritionists and your massage therapists are also going to be helpful as far as being able to discern that there's something not right. I've been trying to get your body into a better place, and I'm just hitting a brick wall, and that's where you want to think dentist. There's got to be something dental going on in this person's mouth that is not allowing the body to function like it's supposed to. So here's a good example. This woman came in for thermography, and of course I'm not going to show you her breast thermography, but when we did the thermography, she actually had a lesion, and we ended up referring her out for ultrasound. But when I do breast thermography, I also take pictures of the head because I've been collecting data with women that have root canals and correlating that data with breast cancer. And what we found was this white area that you can see on the screen. That's the hottest area, and it ended up being a root canal tooth on number 14 that had reabscessed. Now, I don't know whether this is coincidental or not, but that tooth number 14 is on the breast meridian. And we'll talk about that a little bit, just to let you know that each of the teeth are connected energetically to other parts of your body. And when I first started getting into this, I just thought that, you know, I had never heard that before. I did not learn that when I went through University of Texas Dental School. I hadn't heard it anywhere from anyone. And yet when I started working on my own thesis, and this was being presented to me, I started doing data collection, and I just polled people and said, tell me what your health problems are, let me look at a Panorex, and I started doing data collection as far as where the root canals were, where their extractions were. And as luck would have it, I had an overwhelming number of men coming in with elevated PSAs, and it seemed that they almost always, probably high 95%, had a root canal or an extraction on one of the teeth that had to do with the prostate. So it was one of their forefront teeth on the maxilla or on the mandible. And that kind of was eye-opening for me and led me on another path. Giving you some of the old charts here. Here's one of the really, really old ones to show you some of the teeth related to different organs. You're going to notice the X in the center there. The maxillary molars are related to the mandibular bicuspids, and vice versa. The mandibular molars are related to the maxillary bicuspid. That became really confusing to me, so when I was working on my thesis work, I put things in color. I have a son that's Asperger's, and so we do a lot of things that are very visual, and this was helpful for me. So you see those yellow areas in the front where we're talking about those maxillary anterior mandibular teeth? Those are all having to do with the kidney and the bladder and the genital urinary tract, and then we look at the area of purple, and that's the liver and gallbladder and the eye. So you hear the old adage, I'd give my eye teeth for something. It really is on the energetic pathway for the eye. And then you'll see that crisscross, which for me was much easier tracing it in color than it was just the X that was on there. So we're going to talk about root canals for just a moment. Dentistry has very valiantly tried to save teeth by taxidermying them, and in some instances that can create a chronic low-grade infection that a physician is not clued in to look for. Recently I had a gentleman that came in with a hemoglobin A1C of 12. And by the time I finished talking to him, I walked him over and took a Panorix, and sure enough, he had a huge abscess, but he wasn't complaining of any discomfort whatsoever. And so it just threw his sugar all out of balance. But these root canals can create an energetic block for the body, which is even worse. When we're taxiderming the tooth, we're taking out the nerve and the blood supply, which used to allow electricity to flow, and now it's completely blocked. I would encourage you, I would beg you, please go to my website and watch the Oral Obstacles to Optimal Health. On the side on the left, you'll see a little thing that says lectures. And if you'll click on that, it's in 3 parts. And if you have any feedback, I don't care if it's positive or negative, if you have a comment and you feel that something I'm saying is incorrect, I am always open to suggestions. So please go through there and give me your opinion.
That's what I like about you, and I like about the IABDM too, Dawn, is that it really is a safe environment for free, open, and frank exchange of different viewpoints. I also like, when people hear about meridians, sometimes people might think it's a little bit metaphysical or even flaky science. But when we're talking about like root canals, I mean, you're really getting down to some pretty tangible scientific explanations of how there are blockages that occur that, basically leaving a dead tooth in a mouth without its natural tissue can interrupt the flow of electricity, which we all know is an essential part of life. So I think this is really, really compelling.
Right. Here we have, this is another patient that was absolutely not complaining of any discomfort whatsoever. And, of course, you can understand why, because it's already had a root canal. You look at the materials, and it seems that the materials have gone beyond the apex of the tooth. But regardless of that, there's an infection that's there. And oftentimes these people come in and they argue with me that they even have a root canal. They don't even remember having a root canal done. When we look at how serious these can be, we start finding information that shows that the bacteria that's in there that's anaerobic, as well as in a cavitation, which I'm getting ahead of myself, but that anaerobic bacteria can actually interfere with our oncogene, which is P53. Which gets back to the small percentage of people that I saw that had elevated PSAs that didn't have a root canal or an extraction on one of those areas that was related to the meridian. In fact, they did have a root canal elsewhere in their mouth. So when we get those interferences, the root canal toxins completely inhibited our P53. And so that means that one root canal could alter someone's immune system. So if you don't have enough good health to give away, then you might be thinking of these in a different light than what you did before. So I'd like to now backtrack to the word that I dropped, which is a cavitation, which some people are very aware of. It's an area of the bone that's not completely healthy, and it can be caused from trauma. It could be caused from where a tooth was removed and it didn't completely fill in. It doesn't have to be associated with pain, but originally Dr. Bocoe coined the term neuralgia-inducing cavitational osteonecrosis because he was finding people that had had extractions that had pain that was very similar to trigeminal neuralgia. And when you went in and cleaned these areas up, going in and removing the dead bone that was there, the pain went away. Here's an example. If I could show you this person's x-ray, you would not see any deformity on the x-ray. You would not have a clue that this was here. You're going to see lots of trabeculae filled in, and it's going to look like solid bone. And yet when you make an incision through the gum tissue, oftentimes you'll find a very, very thin layer of cortical bone that's like styrofoam that you'll pop right through, and then you'll have this oily substance underneath there.
Not good.
No. And, of course, here's a cadaver bone. And this is courtesy of Dr. Bocoe. And just showing you that, we've got the necrotic area here. And, again, electricity can't go through there. So if we're making some choices where people are having teeth taken out, what would you want to replace a tooth with? first off, I always tell a patient nothing is good as what God gave you, so you should be brushing and flossing and taking care of those teeth. But short of that, accidents happen, and some people end up losing their teeth. I would encourage a patient, if they have a healthy body, then they can look at other alternatives besides removable appliances. I choose to call those removable retainers because I think when you start talking to patients about partials, they think of their granny, and then that makes them feel old. But if they're going to be considering implants, then I usually try to steer them towards someone who does zirconia implants, only because I'm very leery of titanium and what it may do as far as suppressing a T-cell count, or what it may do as far as sticking metal directly into the bone. So I usually give the example, if I stuck a spoon in an electric socket and bent it around and stuck it in the bottom, it would short out that socket. I'm not so sure that that is maybe a healthy choice for the individual. But if they were going to have an implant, I would really want to encourage them to get a test called perio-ID. It's an interleukin-1 test. If they show up positive, then their body overreacts to absolutely anything that causes inflammation. This is the patient that comes in that does a decent job brushing, but their gums bleed like crazy. They floss, but it's not perfect, but still they overreact. So the risk is that that person may be at higher risk of rejecting any implant, whether it was titanium or zirconia or whatever. And that test is done through a company called Oral DNA. They provide a couple of other tests that you absolutely should be using in your office. They do a test that lets you know if the bacteria in their mouth is associated with cardiovascular disease. They also do an oral herpes test. They're all saliva tests that are very, very easy to do, and another profit center for your office. Again, I would tell the person that they need to get tested to make sure that the material is okay for them, regardless of whether they're going to use titanium or zirconia. We get back to our team, and that patient is depending on a lot of information it's not possible for one person alone to have. They need someone who can look at the systemic causes of their decay, or why teeth are dying. You realize that people come to see me and I'm telling them, okay, your constipation is actually part of the reason why your teeth are having problems. So let's get your bowels moving on a more regular basis. They also need to know if the dental infections are contributing to health problems, or whether they have clotting problems or those genetic flaws like the MTHFR. They need to know if they have structural problems or blood sugar problems that are going to make them more at risk for having dental decay or for rejecting an implant. That patient is going to require the entire team to remove the toxins out of their mouth, which is the infected teeth or heavy metals, and then to stabilize and do the chelation or other corrective problems. So here's where we're talking about that network that is Danny's very good at creating. By now, if you're not a biological dentist, I'd love for you to be asking yourself the question, how does one become a biological dentist? Well, of course, I would tell you that you need to join in with us, because I would help get referrals to your area. We can provide mentors for you of doctors that have been doing this for a while. It's not like you can just flip a switch and decide, I'm going to be a biological dentist. You won't have necessarily all of the equipment. Your staff might not be on board. By the time you start learning some things and taking it back, you might actually have to do training with your staff, or you might even have to get different staff.
Well, I think it's an interesting point you mentioned earlier, Dawn. I'm sorry to interrupt, that you mentioned all it takes is one team member to roll her eyes when you offered that. I wonder if you, and I think that's really important, that as with everything, it's vital that you receive buy-in from the team. And speaking of the team, I want to apologize to the hygienists on the call. That was a inexcusable and material omission on my part to not include hygienists as one of the practitioners, because as we know, and as I'm very committed to encouraging people to know, hygienists are in the trenches. They're in the front line. And much of what we're talking about today, and I guess the ability to provide some of these services varies by state, but the hygienist is one of the key players, not only in delivering the care, but I think in helping grow the referral network by speaking the language of the other practitioners and walking the walk. So again, my apologies to those of you who are,
Danny, wonderful,
including you,
wonderful point that you bring up. I mean, our group embraces hygienists. In June, we had a biological dental hygiene meeting in my office and the biological dentist that's next to mine. And we did everything from learn about how we could measure our patient's pH in the saliva, how we could look at the nitric oxide level with a simple test strip, and we could generate revenue within the office by turning the patient on to things to get their nitric oxide level, looking at outside of the box ways to address perio non-surgically or using laser, and we'll be having more of those. And those mini meetings are only available for members. We put on meetings that will be anywhere from, I'm going to say 6 to 20 people in a very intimate environment throughout the year, and those courses are anywhere from 8 to 36 hours long, and you can't get CE for that. I mean, this last one we put on was $200, and there's just no place that I know of that you can get that kind of CE for that inexpensive.
I think IABDM is one of the best values going, and I've only been exposed to it for the last year or so. But did you know, Virginia and I had the pleasure of attending one of your CE cruises, and it was just amazing. It's kind of like getting hit by a fire hose at times, but you know, we had exposed to a lot of information and valuable information. And you do this on an ongoing basis. I frankly don't know how you do it and still maintain a practice, but I hope you'll keep doing it.
I'm very passionate about it.
That's self-evident. And so as we can see on the screen, Dawn, why don't you share with our attendees some of the offers, and obviously if it's, there's no quiz, but if you have requests for any clarification, you can see how to get a hold of Dr. Dawn off after the call.
Absolutely. Our annual membership, which is normally $495, if you're on the webinar tonight, we are offering a $100 discount. I didn't even think about the hygienist. I would love for you guys to join, and I certainly will find a way to make it worth your while and offer you a discount if you will just email me and get in touch with me about that.
How about if they drag a dentist along, you comp them or do something? I'm going to get in trouble. For
I definitely will make it worth their while. We're getting very involved with hygiene as some of our members own their own practice in Canada, and so they're becoming much more active in that arena. We also have October 19th through the 21st is our next annual meeting. That's our big meeting. And if you sign up now, you'll get $100 off the registration fee, and you'll need to put in the coupon code webinar if you're going to sign up online. Otherwise, you can feel free to email me, and I will email you any registration forms or anything you need, and it'll be on a one-on-one basis, and I'll still offer you the discounts there. But I encourage you all the time. We're going to have Dr. Joe Mercola as one of our speakers. So we've got a really good lineup of speakers. Dr. Hal Huggins will be there, and Brendan Stack will be there. Dr. McElway will be talking about homeopathic remedies. So there'll be a wide variety of different things. Chris Shade will be there talking about heavy metal detox. So please hit the website. If you go to www.iabdm.org. And Danny, I would like to make these slides available for anyone. I do have permission to use the slides from Dr. Boco, and if you would like to use those slides for a reason, then that we have permission to do that as well, so we're not plagiarizing.
Absolutely. Yes, all attendees will receive a link to download the presentation, so as well as the recording. This entire presentation is being recorded, so I hope no one was bothering taking very copious notes like on the links. Dr. Dawn has some really fascinating videos on her website. One is the smoking tooth, which I think illustrates that mercury is anything but sequestered from in teeth, and a number of other ones that she'd mentioned. The meeting itself, I'm super excited about the annual meeting because I'm going, and it's a wonderful opportunity to network. And another benefit, which it kind of shows sort of how sometimes the consumer marches ahead of the practitioner is that as a member of IABDM, anyone that is seeking information on a biological dentist in their area will be referred to you. And I was actually surprised to hear from Dawn that you're getting daily requests, are you not, from around the country?
Yes. In between me seeing patients, I am online constantly, and it got to a point where it was so much so that I've had to enlist the help of my husband, who's retired. So we get phone calls every day. I get emails every day where people are trying to get connected with a biological dentist, and the sad thing is there are states that I have none.
Mm-hmm. Well, that's just an opportunity as we see it. And, you know, likewise, AIM Dental Marketing has been committed for some time to helping practitioners grow their biological and oral systemic practices through adopting what we like to call the 3 C's of oral systemic and biological practice. And those are clinical proficiency, the ability to collaborate and to grow your professional referral network, and then communications with both current and prospective patients to, first of all, make them aware of the difference, and then help them understand the value of your unique offering, and then get them to accept the treatment, which benefits everyone. This is what we like to say, improving patient outcomes while increasing practice income. Now, we do have some questions from the audience, and let's see if we can get some feedback on those. One caller, one attendee asks, do you know of any composite or restorative material that is BPA free?
Wow, we created a list within the organization, and then we were told that that wasn't the brightest idea for us to do that.
Excuse me.
I think if you look at Diamond Crown and Diamond Link, they are BPA free.
Okay. Well, I always tell everybody to turn off their phones when when I'm lecturing, and of course I forgot to turn mine off. Another question that's related to that, you talk about the potential for BPA in resin, or can you talk about the potential for that in resin fillings, and whether you have any recommendations in that regard?
As far as the materials, well, there are more than just the Diamond Crown and Diamond Link products that are BPA free. And I know that here in Houston, we have a dentist that's part of her big marketing tool is that she posts, you know, I'm a BPA free practice. Whereas years ago, I remember when we used it to our advantage that we decided to go latex free. And that went all the way down to the rubber cups. And this is way before anybody else was using the nitrile gloves. And we got a lot of patients in who were reactive to latex, and so they chose to come. They didn't even care that the rest of the office was biological. So, I mean, I know there will be sources out there. I don't know that I'm at liberty to give those out.
Sure.
But I do know that Diamond Link and Diamond Crown are BPA free, and that would be a wonderful marketing tool for someone to start. I just want to say one other thing. My practice is a cash-only practice. Patients are so smart. They come in. They have educated themselves on the Internet, and they don't care that insurance doesn't pay for whatever it is I'm doing. They just want it. And
that's a really exciting shift. Yeah, I've seen that in my own.
A really good practice. You can do that.
You can, and the media are helping. They're helping people understand that these are valuable differences. And I think on an intuitive level, we're learning that the best doctor really for ourselves is ourselves, and that we need to be advocates for our own care. You know, I just signed up to be a patient of Dr. Mercola's. It's convenient for me. It ain't cheap, but I know that they're going to be paying attention to me and doing assessments that are going to enable me to see where I could improve my health and fitness and wellness. And so I'm only too excited about that. I have, speaking of marketing materials, can you suggest how and where people can get the meridian charts, perhaps online?
They can
Or?
go to my website, and they can order one of the Meridian charts there. If they go, just go to www.drdawn.net, and you can, the color chart that's on there, there are a gajillion out there. Gosh, when I was working on my thesis, there's probably 30 different charts out there. The massage therapists have a chart. The chiropractors have a chart. So what I did was I took as many charts as I could find and tried to put them all together. So the dermatomes are on mine, and the only thing that I don't have on mine is emotions, and I wasn't really sure where that chart came from or how true it was. I had never seen it before, so I chose to leave that off of mine.
Well, that's a question I have too. Is to what extent are these Meridian charts standardized, so that if they walk into, especially part of the same referral network, are they going to see the same chart in the chiropractor's office that they will in the dentist's office?
Yeah, you'll see a few differences, like the one that I showed you where they choose to be drawn out different, or they won't put all the organs on there, or they won't put the vertebrae on there. It'll just be snippets of it. But most of them are going to be very, very similar. The book that I authored, which is Let the Tooth Be Known, and I did that, oh my gosh, now almost 20 years ago, was my thesis work. And I would encourage people to look for that. It should be coming out in the e-version soon. And so people can download it and read it on whatever you want. And it would make it much easier for me. Shipping it over to Europe is insane. The shipping prices are just crazy. And so now I can get it all over to Australia just simply by being an e-book.
Very good. Somebody asks if you know if Venus Pearl is BPA free.
No, I do not know.
Okay. So we'll hope to find that out. And another question, are you removing composites or recommending that composites be removed that have BPA in them?
I test the individual to see if that is an issue for them. The same thing with gold. We stopped using nickel and we thought gold was more precious and would be better, and yet we found out that sometimes when we put a gold crown, it would stimulate the meridian. And it would stimulate it so much so that we actually were documenting cancers. And so we decided to go metal-free as much as we possibly could. And again, there is just nothing as good as what God gave you. Your enamel is so precious, and we take it for granted.
That's absolutely true. Well, Dawn, I want to thank you. We are at the end of the questions. We actually ended early. I know we were concerned about packing too much material in, but I think you did a very good job of pacing us and provided a lot of insights, and I think a lot of areas for further investigation, as well as opportunities for people to receive those resources. So again, I want to thank you, Dr. Dawn Ewing, for contributing and being our guest presenter of this installment of Practice Perfection. And I want to thank you all, dear attendees, for taking the time. And please stay tuned. We will be sending you links to the recording of this presentation to review or share with your colleagues. And we'll be inviting you to future, equally, I think, relevant and timely presentations on the subject of oral systemic health and wellness. So for now, I'm Danny Bobrow. Thank you all, and have a pleasant evening.